my next guest that we're going to be having now. So do join us on Facebook. If you have any questions, feel free to drop them or on our WhatsApp line as well. 0609041056. Connect with us in the studio. Now we are in June, and that is actually Cataract Awareness Month. So we're putting the eye health in focus right now, discussing the signs, the risk, and the life-changing treatments that are available for cataract. So whether you're over 60 or you're just caring for an elder or just want to know how to protect your vision, then this conversation is for you. Joining us now on our screens and the airwaves is Dr. Sri Kewal, and she is an absolute pleasure to be connecting with. She's an ophthalmologist. Good morning, Doc, and welcome back to Urban Woman.
Good morning, Razia. It's wonderful to be here. Wonderful.
I'm missing your energy here, but you're looking amazing and so lovely. We can see the visuals in the back because at least when you speak now, we know what's going on. But let's just start with the basics, right? What exactly is a cataract? Because we hear a lot of people saying, I have a cataract, I have to go and remove it. And many of us try and wonder what exactly is it? And how does it affect a person's vision?
Razia, a cataract is the clouding of the natural lens in our eye, and it's a perfectly normal aging process. And it's the clear lens that becomes opaque with time, and patients presents with loss of vision. They have blurred visions, there's decreased color sensitivity and contrast sensitivity, and they have worsened night vision. That's one of the most common presenting complaints.
There we go. And are they only associated with old age, or can younger people also develop them?
Mostly age-related, Razia, but younger people can develop cataracts, especially if people are diabetic, if they have been using steroids, oral prednisone for a long time to treat their other systemic conditions, if there's a history of orbital trauma, they can present with a cataract earlier in the younger ages. There's also a small population where babies are born with cataracts, and that we refer to as congenital cataracts.
Okay, interesting. Thank you so much for sharing that. Share with us some of the most common symptoms that we can actually be on the lookout for.
So patients should be aware of if they ever develop blurry or cloudy vision, night glare or halos. Often patients will say they just cannot tolerate the lights from oncoming traffic anymore. There's so much of glare, halos. The colors aren't as bright as they used to be, and they find themselves changing their prescription spectacles more frequently. So they should be aware if a cataract is developing.
Right. So people pay attention to your eyesight. And as I always say, sometimes we think it will just come right eventually. No, if you're getting those symptoms, then go and have it checked out. And Doc, how can we tell the difference between just general poor eyesight and the onset of cataracts?
Razia, if the glasses don't help and don't improve your vision and you struggle with the glare or the contrast, it may point to cataracts rather than general eyesight decline due to a refractive error.
And what causes it? Is it like just genetics, or is it lifestyle related, or even could it be environmental factors that lead to that?
So aging, as we age, protein gets deposited into the lens of our eye, and that's what causes the opacity. Diabetes can cause the cataracts, smoking, exposure to a lot of sunlight, prolonged ultraviolet exposure, and poor nutrition are to be known causes of cataracts.
There we go. Thank you so much. And I think when it comes to our teeth, we kind of know how often we should go and check them out. What about eyes? How often should we have our eyes tested or screened, especially over the age of 40? Because we often hear over the age of 40, things become more important.
Absolutely. So importance of screening after 40 is very important. It helps detect early changes due to cataract, glaucoma or pressure in the eye, or conditions like macular degeneration. and early detection allows for early treatment. In that same note, Razia, I'd like us to remember kids should also be screened before they go to school, always. That's
Yes. It's
okay.
interesting how when I speak to some of my clients and they say that we didn't know my child had a vision problem. And then
Correct.
later on. So, I also realize that this is something we don't realize. We need to check out their eyes. We need to check things out because we just assume everything is okay.
Because
And doc, tell me something. Hmm?
a child can't verbalize that they can't see because they don't know better.
How true. How true. Only we will know through experience, right? You can tell the difference. What about for those who actually suspect that they may have cataracts, but what comes into the humanness of us is that fear of a checkup or fear of surgery. What's your advice to them?
Understandable. Fear is natural, but cataract surgery is one of the safest and most effective procedures done. And a checkup is simply the first step. It's not a commitment to surgery, but just a diagnosis needs to be made. Is there a cataract or not? And what are our options for management?
Does it? There we go. There we go. It's as simple as that. And yesterday we were in Peter Marisburg. We had a wonderful OB down there and was all around health and health screenings. And we had Midlands Medical Center personnel that was there. So it was sponsored by them. And it was beautiful because, again, it gave people the opportunity to just find out how's your health going. And of course, then you can take the correct steps and precautions and things like that, or just have that peace of mind. So you're definitely reinstating that and reaffirming that. There's also a message coming through. What do we do if our oil glands are blocked? Because I have some lumps on my eyelid, on the one eye, and below the lower eye, basically.
Eyelid hygiene is very important, Razia, in this case, where we advocate washing of the eyelashes and the eyelids to degrease them.
Mm-hmm.
There are over-the-counter preparations available, or sometimes just a gentle baby shampoo wash would work. And warm compressions to open up the pores and open up those block ducts would help to release some of those extra oils and prevent the styes from forming.
Wow. So that's when you can visibly see it outside. It's the same thing, Doc. Am I right?
Correct. It's coming from the
Okay.
meibomian glands that line the upper and lower lid, and they secrete oils that make up part of our tear film. So they play a very important role, but they also have to be regulated well.
Look at that. So even our eyelashes, huh? We just think it's the hair that needs the shampoo, but these little lashes here need shampoo as well. Thank you so
Yes.
much. I hope that answers the question to the listener that sent it through and wants to remain anonymous. Doc, it's been so wonderful having you on Urban Woman this morning. Always wonderful to see your beautiful energy. We wish you a lovely day further. And until we connect again, any last message for our Urban Woman listeners this morning?
Uh, Always remember your eyes. Always remember to take care and screen, and it's one of our most precious gifts from God.
The
Thank
windows to our souls,
you.
isn't
Yes.
it? Thank you, Doc. Until we connect again. Have yourself a lovely day.
Unity. Okay.
On your
Bye.
pleasure. Bye for now. And that was ophthalmologist Dr. Jyoti Srikwal and chatting with us about cataract, as June is Cataract Awareness Month. So remember these little lashes here, right? You just think they're all good. Oil builds up and so much more. But coming back to cataracts, if you're over 40, age related, getting those blurry visions and things like that, colors going a bit dimmer, not so bright. Don't think your life isn't bright. Basically, go check your eyes out, nip it in the bud, take action, and do what's necessary. It's time for a break, and I'll be back thereafter. It's Urban Woman with me.